Hello friends, hope you're well. In this video, I want to talk about how to add value to your offer when you're starting a home care business, specifically during the assessment period. And this is where you need to articulate the value of what you have to offer. So you can start to command and ask for the rates that you actually deserve in this economy. But first, before we jump into this video, let me introduce our guest again, our special guest. Welcome back to the channel again.
Thank you.
Yes, we're happy to have you back. Well, I came across this video that was recommended on my feed on YouTube the other day. Dr. Phil was talking about how, these older people in the 70s, 80s, and 90s, the baby boomers, are being cut off by their kids. Have you heard about this?
Yes, I've heard about that too. And one of the reasons why that is happening is because, there's a high inflation that is happening in the US. And people are already stressed out with their jobs, with the cost of living, and other reasons. So they don't want to deal with either stubborn parents. When people get old, they become really stubborn and very hard to take care of. So in order for them to kind of have their pace, they try to keep a distance. And
not only that, I feel like there's a disconnect between generations. If you speak to somebody who's our kids' age, because our kids are 8 and 5.
Right.
If you speak to our kids, then you speak to the Gen Xers, or Gen Zers, or baby boomers, they're completely detached from what the reality of each level is. So baby boomers have no idea what's going on with the Gen Zers. They have no idea how difficult life has become for their kids.
That's so true. They're stuck with their ways, like their old ways of doing things.
Some have even been giving bad advice to their kids and saying, go to college or rake up all this college debt.
Because that worked for them, and they don't realize that times have changed. It's not the same way as it was for them. Every generation is, with technology, things change a lot.
Yeah, and there's a lot of friction now, if you've noticed, because they would look at that younger generation as people who don't listen.
Right.
Which is not the case.
That's not the case.
The economy is different. With all these budget cuts from the federal government, with this new administration of Trump, things are out of control.
Out of control, yes.
I'm seeing they're making cuts to Medicaid now. By the way, I've done a video about how if you're relying on Medicaid 100% or Medicare 100%, you're going to be in big trouble. So please go watch that video. I'll probably link it at the end of this video. Please go watch that video. It's really relevant right now to go and watch it, because what's happening in this economy is no joke. And it's causing a lot of rift between families. Even relationships are not working out well.
A lot of relationships now are not working out. A lot of people are not getting married or, marrying because of what's going on right now. It's a disaster going on.
It is a disaster. They used to say the number one reason why, relationships end, marriages end, is infidelity. I don't believe that. I believe what's happening in the United States is financial.
Yeah, financial is number one reason.
The number one reason relationships break up is financial, for sure.
So like you're talking about the elderly, part of it is that they do have good intentions, or the best. Any parent out there has the best intentions for their kids. But what they don't realize is that what worked for them during their generation is not really working for this maybe Gen Z generation. You get what I'm saying? So what happens there becomes like a conflict between, because these people are stuck in their ways, and these people are trying to explain to them that this is not how things are. So now that's where they end up having conflicts and they don't get along, and then the kids decide to cut off their parents.
Guess who ends up taking the brunt of all these problems?
The caregivers.
Unfortunately. I'm even hearing stories of nurses who are being forced to call up patients' kids to deal with day-to-day problems. For example, things like paying mortgages, paying bills. What are some of the, issues that, a lot of these people would face? Because you run this house, you run the household. So what are some of the things that might come up when a patient is, let's say, in an emergency situation and doesn't have somebody they trust around them like family? What are some of the things that come up?
There's some of the things that come up. Of course, they will need help with how to pay their utility bills. There are things that in the house that need to be repaired and they need a plumber and they don't know how to go about it.
Or they might not even have the time. They might know how to do it.
They might not really have the time, or they might need, a contact or somebody to help them on how to get somebody to come fix to fix whatever repairs that they have to do in the house. You get what I'm saying? Or another issue that may come is it might be something very small. Somebody to cut the lawn.
Yeah.
So they might need help there. Yes, it might sound like it's not a lot of work, but that's like out of scope of work.
Yeah.
So the point here that I want to say is that because your job is known that you need to do it, to take care of the patient. So these other things like having to pay their utility bills, or maybe they're having conflicts with family members, or they don't get along with their kid. Now you have to come in between and be the one, like a messenger pretty much, communicating between, the child with the parent. It's a lot of work.
It is. Once a parent is cut off from their kids, a lot of things start to get messed up when it comes to communicating family issues.
Right.
It could be estate planning. Mm-hmm. It could be funeral arrangements.
Yes.
What if that patient is given diagnoses by the doctor that they only got 6 months to live? These hospice patients. Mm-hmm. How do they plan burial arrangements, funeral arrangements? All those kinds of things will be put on the caregiver to deal with.
Yes.
And communicate that information mm-hmm. with the next of kin. And it's not fair to the caregiver.
Yes, because that's not part of what they signed for in terms
Precisely.
of work. That's how you bring in your value to your home health care agency, where you provide those kind of services, but at a higher rate. If you used to charge a certain rate, but now you have to advertise to the people, to your clients, that you also provide those extra services in case you need them, but at a higher rate.
Yeah, we actually have a relative, we don't mention names obviously, but we actually have a relative, a perfect example of something that happened where he's relatively young, in his 40s, mm-hmm. and he had a stroke.
Yes.
And he's very fortunate that he has a lot of siblings, yes. But he lived alone. Yes. And he owned a home. Yeah. He still owns the home, fortunately. Mm-hmm. But he had at least his siblings come over
and take care of him.
He had 3 sisters?
Yes.
3 sisters that came over to take care of him, mm-hmm. and he's also a Medicare as well. Mm-hmm. So there was a Medicare caregiver, mm-hmm. but also mm-hmm. his siblings were there to help out with simple things like paying bills, yes. Making sure his mortgage was paid.
Yeah, doing grocery shopping.
Yes. Because if he didn't pay his mortgage or his HOA fees, yeah. he might lose the property. Or his car insurance. Yes. All these things that are annoying, he was doing for himself. Mm-hmm. He
can do them.
He can't do them.
So somebody has to take that responsibility.
Precisely. Mm-hmm. And when these types of patients, they might have dementia, but what if they have a stroke? They might have Alzheimer's, but what if they have a stroke?
They have a stroke, yeah.
That's a new condition that you're not
yes.
able to deal with as a caregiver right. or as a home care agency.
Yes.
So you need to be prepared to be able to offer additional value yes. on top of what you've already signed up for.
Whatever services that you're providing.
For example, right. It could be family therapy. Mm-hmm. If you know during the assessment period, this is information that you can acquire during the assessment process, yeah. where you would ask things like, how do you get along well with your next of kin? Do you have kids? Mm-hmm. These things come up during the assessment process. Right. Yeah. So you as the home care agency owner, you should be able to extract enough information yes. to be able to assess and know mm-hmm. that a potential issue might come when it comes to communication.
Communication, yes.
And then if you have to deal with that communication, that's an extra fee now.
Yes, but also the home care agencies, they have to make sure that when they're employing these CNAs or home health aides, they have to make sure the people that they're employing are good at these skills. Like communication skills is very, very important.
Yes. So the CNAs, home health aides, will be good at activities of daily living.
Yes.
But they might not be good at offering good advice on how to handle family dynamics, complicated family dynamics, let's say. So this is where, as a home care agency owner, you might need to partner up with a therapist.
Yes.
A family therapist. A family therapist that will be on standby. Then you communicate when the time comes that you do have these services for offer.
But also it's the job of the CNAs and home health aides to communicate all these issues that are coming up, because there are times when these elderly clients bring up issues like, oh, you know, I'm not getting along with my son, or I'm trying to call so and so, they don't pick up the phone. They tell you all stories,
all their problems
that they're going through. So it's the best of the interest for the caregiver to be able to write that stuff down, everything that has been said by the client, to write it down, so that when the family therapist comes in, she's the one that will be communicating on behalf of the patient or the client.
Precisely.
You get what I'm saying?
Yes.
So this is why it's important to make sure, you see, the little things matter, for them to have notebooks whereby they write down things like
everything.
That. Anytime when the client complains about something, they have to write it down, just like
that's why I have a notebook, so I don't forget everything.
But sometimes, you forget.
You forget, absolutely. Speaking of not forgetting, is if these things don't happen on your side as the owner of this business, it means you won't be able to ask for the amount of money that you deserve. Because offering activities of daily living, anybody can do that.
Yeah, everybody can do it. If these patients or clients have maybe relatives that they get along with, they can still come in maybe over the weekend and do those activities.
Yeah.
But there are certain things that are more important. Communication. Communicate, do observation. So observation is one of the most important things that CNAs and home health aides need to do. Observation, communication skills are very, very important. That's the best way you can help your clients. And that also puts you in a position to be confident to charge more money, because you know that you have very good employees who are doing a very good job. Because at the end of the day, you're trying to help these elderly people.
Yeah.
Yes.
It's scary because a lot of these old people, they're going to have to be in a position where they are selling their houses. And again, we're dealing with people that are well off here, okay? We're not dealing with...
We're talking about private paid
clients. Let's forget the Medicare, because there's no real money in 2025, unfortunately. Because I spoke to a lady recently, I told you about this, who is getting paid by Medicaid $28 an hour. And then she's paying her caregivers between $15 and $18 an hour.
That's not enough.
That's not enough to survive in this economy, unfortunately.
Yeah. What those caregivers are going to do, they're going to quit the job without even letting her know. She just see people quitting, and they don't tell her the reason why they quit. That the reason why they are quitting is because the pay is not good. The cost of living has gone up. You see, everything, when you go to the grocery stores, everything has gone up. So they want to get a job whereby they are being paid good, so they can, they can survive.
Exactly. Eggs alone, I'm sure in some states like New York, at least New York City, they're probably like $15.
Remember you told me about the bananas?
Yeah, I bought 4 bananas and a bottle of water for $8.
That's
it's insane. It's insane, and these caregivers will not tell you.
And honestly, that job is not that easy. I've been through it.
It's very difficult.
Yeah, I worked as a CNA before, and honestly, it's not that easy. Dealing especially with this very, when people becomes, at a certain age, or when they are old, they are very, very stubborn. So
the good news, guys, is this. This is a profession, this is an industry that is very difficult to replace with AI. No robot can come and replace a caregiver.
No,
So
at all.
caregivers, people who have physically demanding skills,
Yes,
are not going to be replaced by AI. No robot can come and replace you.
that's right.
So which is why it's such a great business to get into in 2025. I was listening to radio when I was in Atlanta.
Yes.
This lady, she had a medical emergency that cost her $21,000.
That's a lot of money.
And then she only had $14,000 in her account. But she was living with a son in her house.
Yes.
So she spent the $14,000 on this medical emergency, and then she still needed to come up with more money. What do you think she's gonna do? She's gonna have to sell that house, unfortunately, and downsize. And this is what will happen
move
to
to an
her.
apartment or something like that.
Yeah, and then, unfortunately, a lot of people are gonna have to do that who are
They're gonna have to
elderly.
do that, yes.
Yeah, that's the new trend that's coming. So there's gonna be a lot of money that in this business from people selling everything. Because people do not compromise when it comes to healthcare. They don't compromise.
They don't compromise because your health is everything.
It's everything. Without your health, you got nothing.
You got nothing.
Yeah. So we're going to see this rush. It's already happening in Florida.
Yes.
People are selling their properties over there in Florida. So we'll see. We'll see over time. We'll see how this whole trend goes. But I hope you guys got some value from this video, and to understand that adding value starts with simple things like that. Anticipating, really.
Yes, yes.
Anticipating some of the needs of the patient beyond activities of daily living.
Daily living.
You
Yeah,
know,
like,
like
for
the
example,
family
you
therapy.
said the family therapy. And also making sure that the employees that you're hiring, because they have to go through, how you call that, orientation. So there's training that these caregivers need to have at least once a year, whereby they are reminded of their tasks. But in addition to that, you make sure that these people are very good communicators. They speak good English. There are people in the States that barely speak the language. And then there are those that are fortunate they speak more than language. There's a lady that I once met who speaks about 5 languages. She speaks English, fluent German, French, Spanish, and is it Dutch?
Wow, that's a
Yes,
lot.
That's a lot.
Wow.
So this lady was in a position to work anywhere.
Anywhere, yeah.
Yes.
She could
So
focus.
you have those kind of, those are
Yeah.
rare. They're not,
Yeah.
not everybody can speak all those languages.
Yeah.
But what I'm saying is that it's just good to have people who can communicate, because the elderly sometimes, maybe she will, let me say I'm the CNA who's working, right? And maybe now my client is maybe used to me, she's developed trust, and the client likes me. She's going to be in a position to open up to me and tell me all her problems.
Yeah.
But when it comes to the family therapy, she won't be able to communicate that much.
Sure.
So me as a caregiver, I should be in a position to communicate each and everything that my client tells me, so that she can get help, because this person needs help.
Sure.
Do you get what I'm saying?
Yeah.
And this is why I keep insisting, even during the trainings that they get, the orientation and the trainings that they will be getting every year, at least once a year, these home care agencies or home care agency owners, they need to make sure that they communicate to all the care. If they, in the process of even providing little notebooks for them, and tell them, you know what, you have to make sure that you write each and everything. Because some of these patients, at times they have episodes. You understand when I say they have episodes? One day things are good, and then another day, especially dementia or Alzheimer's.
Yeah.
So you need to be in the position to write all those things down.
Sure.
So that when the therapy shows up, you have a whole list of that information that the therapist needs to know in order to give the patient the best services that they need, or the best care that they need.
And that family therapist, definitely, that recommendation has to come from the business owner, I would recommend. Instead of you giving that responsibility to the family to figure out how to get their own family therapist, you bring it up. You say, hey, I have access to the best family therapist, and this is how much it costs. Then you can charge whatever you want.
And trust me, the rich people, once you speak about, these other extra services that you're willing to help, like, family therapists and all this stuff, they'll be more than happy to pay you the money
They'll pay,
that you're asking for.
because to them it's about time.
It's about time, it's about convenience, all that stuff.
Absolutely, absolutely. And the good news though, if you schedule time, I'll put a link in the description of this video. If you're ready to work with the best, I'll show you how to get these rich clients to make sure that your agency is in front of these people so that they can find your number and give you a call through online marketing or TV commercials. I'll show you how to do all of that. And then also I'll show you how to make sure you come up with the best rate to charge for your home care agency when you incorporate all these value adds. This is what we call adding value, okay?
Yes.
And then I also just remembered, instead of just physical notebooks, I came across this company, and I need to start using this. It's AI now, because AI is blowing up.
Artificial intelligence.
Artificial intelligence. You can speak into this AI app, and then it'll take notes. It'll organize that into notes for you.
Oh, that's beautiful.
It's amazing.
It is
So
amazing.
if you hate writing,
Yes.
like I do, if your handwriting sucks, you can use an AI tool. Schedule time, I'll tell you all about it. And I'll show you how to get to the clients. Well, thank you so much for sharing your wisdom and knowledge. I appreciate you. And I guess we'll talk to you guys soon. Schedule time. All right, cheers.
Cheers, take care.